Earlier today, the Trump announced two new nominations: Georgia Congressman Tom Price for Secretary of the Department of Health and Human Services, and Seema Verma, a consultant for Administrator for Centers for Medicare and Medicaid Services, a very important position. Now, Congressman Price's position holds the distinction of being one of the few Republican lawmakers to actually come up with an actual plan to replace Obamacare, a bill euphemistically titled the Empowering Patients First Act. As controversial as Paul Ryan's health care proposals have been, this one from Congressman Price is even further to the right, it should be clear. Among other things, Price's bill would let insurers charge more to patients with pre-existing conditions if they have a gap in coverage of 18 months or more. It would give out tax credits based on age bracket. The older you are, the more you get, with no adjustments for income, as in the Ryan plan, which does. Meaning 61-year-old Bill Gates would get more government help than a 19-year-old single mom living below the poverty line. And Price's bill would simply eliminate the Medicaid expansion, a program that covers millions of people, replacing it with nothing. And as the current chairman of the House Budget Committee, Price has also backed Ryan's plan to privatize Medicare, telling reporters a couple weeks ago that he expects Republicans in the House to move on Medicare reforms 6 to 8 months into the Trump administration. It's pretty clear that the Affordable Care Act has some problems that need fixing. But the one unequivocal success of that law is that it has expanded insurance coverage to about 20 million people in this country. Since 2013, the uninsured rate has plummeted by almost 40% to an all-time low of just 10% in the first quarter of 2016. For the first time, 90% of Americans have health care coverage. Those gains appear to have been especially pronounced among low-income whites without a college degree, the same demographic that formed a key part of Trump's coalition. According to the Washington Post, Greg Sargent, the uninsured rate for non-college educated whites with household incomes under $36,000 fell by 10 percentage points over the last 3 years, from 25% to 15%. If Obamacare is repealed and Congressman Price's bill signed into law, a lot of those same, many of them, one assumes, Trump voters, could lose their coverage. But as Chuck Schumer, the incoming Senate minority leader, signaled today, Democrats aren't going to let any of it happen without a fight.
Between this nomination of an avowed Medicare opponent and Republicans here in Washington threatening to privatize Medicare, it's clear that Washington Republicans are plotting a war on seniors. We say to our Republicans who want to privatize Medicare, go try it. Make our day.
And joining me now, MSNBC political analyst Howard Dean, former DNC chair, also a physician, and Avik Roy, president of the Foundation for Research on Equal Opportunity, who advised Mitt Romney on healthcare policy in 2012. And Avik, let me start with you, because I think this is a fascinating sort of substantive civil war brewing. And before we get to the merits of Price's plan or Ryan's plan, would you say there is some real inherent tension between the rhetoric of Donald Trump, the promises he made across the board, Social Security, Medicare, and Medicaid, which he was quick to point out, and the kind of vision of both Ryan and Price?
Yeah, I would say the way you summarize Trump's policy point of view, he's made three key promises. One, I'm going to repeal and replace Obamacare. Two, I'm going to take care of everybody. This is a guy, as you noted in your opening segment, who supports universal coverage. And he said he's going to do it in a way that is less expensive, less costly than the ACA. Those three policy objectives can be achieved. There are reform plans out there. The one that we published at the Foundation for Research on Equal Opportunity, we estimate would do that. And remember, the HHS secretary doesn't write legislation, right? That's the job of Congress, and not just both branches of Congress, particularly the Senate. You're going to have to get 60 votes in the Senate to replace the ACA. So Democrats are going to have a say.
What's fascinating to me here is the Medicare privatization angle of this, because, you know, this is something that Paul Ryan's wanted to do forever. It was part of the Ryan budget. It's been a dream of Republican think tanks. It's been a dream of a whole bunch of folks in the center right for a long time. If there's one thing that there's no mandate for, it's that. I mean, Donald Trump explicitly ran, right, saying this is not going to happen. It reminds me of the Bush Social Security fight in 2005.
That's exactly right, Chris. It is the Bush Social Security fight in 2005. I would have to predict that this is never going to get out of the House. Why? Because everybody who votes for this is going to have an opponent who's going to call them on it. This is the best possible way that you could get Democrats to pick up more seats in 2018.
It's just a simple Medicare privatization fund.
Yeah, I mean, this basically takes Medicare away from people who are hurting, and it gives breaks to people who aren't. And this is insane. There is no constituency for this except among the right-wing think tank people in Washington.
So that's my question to you, Avik, right? So the famous line of Barack Obama when selling the ACA, which Republicans have sort of lorded over his head, if you like your doctor, you can keep your doctor. Even if that was sort of broadly conceptually true, in every individual instance it was not. Clearly, some people lost their doctors, right? Can anyone who's going to undertake this massive change to American healthcare say, look, if you've got insurance now, you're going to be insured? It seems like no one can actually credibly make that promise.
Well, actually, remember in 2010, when Republicans retook the majority in the House, they passed the Paul Ryan Medicare plan out of the House, and they've done that every single year since then.
Right.
And they haven't lost their majority. They've retained it. So it's not obvious to me that there is this huge political price for
let's just be clear,
the Paul Ryan plan.
It's one thing to pass a bill. It's another when that bill becomes law, right? So there is a very big difference in that Republicans have spent 8 years criticizing Democrats' health care policy initiatives, criticizing the Affordable Care Act. If they are successful in changing things, they will own it, and they will, I would imagine, own it entirely.
Sure, but the one really important point about the Paul Ryan plan, it doesn't change Medicare for anybody over the age of 55.
Right,
it changes Medicare for people like you and me, and that's the political genius of the plan, so to speak.
Or deviousness,
really
depending on your interpretation.
Well, except by the time we get through with them, it'll change it. We're going to, you know, I mean...
Wait, say what you're going to say.
By the time we get through with it, people who are over 65 are going to think it's going to be attacking them.
We meaning Democrats.
Yeah. I mean, you think we're not going to give Avik a chance to explain this? This is going to be
I like Governor Dean announcing exactly
what we're going to do.
Right. Well, I remember, Chris, being on your old weekend show in 2012 when Mitt Romney picked Paul Ryan as his running mate.
Right.
And Rachel Maddow was sitting next to me saying, "Oh, this is going to be so awesome. The Democrats are going to be able to torch Romney with seniors." Romney won seniors. He did better with seniors than he did with any other age group.
Yeah.
So,
although I don't think, but it's interesting you say that, because I think here's my theory of the case here. Donald Trump won that Republican primary because he rejected a whole bunch of orthodoxy on smaller government, on entitlements, on sort of free markets and how free markets operate them. He ran as this sort of populist. He ran as this weird sort of big government, quasi-authoritarian. It turned out the Republican base liked that. They don't want Medicare cut. They probably don't want Medicare privatized. And now the problem is that the entire institutional nature of the Republican majorities in both houses of Congress and the think tank world and all the wonks are of the Price, Ryan, Avik Roy school, who've got all sorts of ideas about market competition making health care better, and they're going to get a chance to try that out, even though, as Governor Dean says, there's no actual political constituency for that.
I'm not so sure about that. I think that there is a political constituency for it, and I'm looking forward to litigating that, right? I'm looking forward to seeing whether you're right or whether I'm right about the mandate or the potential for this kind of reform.
Here's what I'm not looking forward to is a bunch of people getting kicked off Medicaid who are poor and struggling coverage right now, and we know that that is part of the Price plan. It's a big part of the sort of Republican agenda, which has opposed Medicaid expansion in every particular.
And that's really interesting. We're going to have a way of looking at that, because in Kentucky they have a hard right governor who is basically busy stripping his own constituents, the modest income white voters,
in Kentucky,
of their Medicaid. They had the best rollout of the ACA under Steve Beshear of any state in the country. They had the best implementation, and the current governor, right-wing governor, is stripping it. And so it's going to be fascinating to see what price they pay. Now, they didn't pay.
Maybe they won't. I mean, this might be a test case of Avik's point.
They may not, but you know, this is taking something from people that they really need.
Right.
This is not.
To me, Avik, the bigger thing here is, one thing we know about the politics of healthcare is people don't like disruption. Whichever way that disruption moves in any ideological valence or direction, and now, if Republicans are really going to make good on the promise they made, they're going to have to disrupt in some way, right?
Totally. Well, you know, the plan that I was talking about before, our plan at the Foundation for Research on Equal Opportunity, which is called Transcending Obamacare, that plan is exactly to your point. It's all about being as gradual as possible at modernizing Medicare and Medicaid and the legacy healthcare system, making it more affordable for people. And it can be done. You know, to your point that you made earlier, again, we should emphasize this. Donald Trump supports universal coverage. In the very first presidential debate, he was asked by one of the moderators, well, you support universal coverage. Why do you do that? And he said, well, yeah, I do. And he still won. So I think the more ideological Republicans who say, no, we don't want to cover as many people as ACA, they're not going to hold sway. It's going to be Donald Trump's vision of covering everybody that's going to matter.
The question is if you could get all that to work together, which I think is going to be
You're not
trickier.
going to get anything done in health care or coverage because it's too expensive unless you get rid of fee-for-service medicine.
Well, right, that's something that Tom Price is not on the side of that.
Changing Medicare? Howard?
Yes, you're going to have to do that. The private sector is going to do it first, which is, I think, the genius of ACA is the ACO, which is going to do this with the private sector. They have to.
Howard Dean and Avik Roy, thanks for your time. Appreciate it.
Thanks.